and there's a frost advisory in the forecast for tonight, because tonight's low is 1 degree with a few clouds. Well, right now it's 40 minutes past 3 o'clock, and residents of some private seniors' homes will now be allowed to take walks and to receive visitors. Premier François Legault made the announcement today, and the changes do not apply to homes with confirmed cases of COVID-19, nor will they apply to the province's network of long-term care homes, which we know as CHSLDs. And Daphné Nahmiash is the acting president of Handicap-Vie-Dignité. This is an organization that advocates for improved conditions in long-term care homes, and she is also a retired professor in gerontology and social sciences at Université Laval. And Daphné Nahmiash joins me now on the line. Daphné, good afternoon.
Good afternoon.
Tell me, what is your reaction to the government's announcement today saying that seniors in private homes can go for walks? They can also receive visitors, provided they get visits outside and keep a 2-meter distance and wear masks.
Well, she didn't just say, because I just heard it myself, she didn't just say in private homes. She said in the long-term care homes they could visit. The only thing she didn't specify was whether or not they could be where people have the viruses in those zones, because there are hot zones and cold zones.
Yeah, they are not allowed in any homes that have any cases of COVID-19, is my understanding. Do you think this is good news or a risky decision?
Well, we have just circulated a petition, and over 700 people have signed it, which states that we believe, and other people obviously think the same thing, that caregivers should have the right to decide and choose if they could go to visit their loved ones in any homes, especially the public homes and the other homes as well. So I am discouraged a little bit by any kind of exceptions. I think that caregivers are absolutely essential to be caring for their loved ones, especially at a time when 80% of the people in the public homes, for example, have some kind of dementias and become very confused. And imagine if they're all alone, and already over 2,000 people have died in all of these residences. So basically, there are quite a number who have died alone.
Was that
in the CHSLDs?
Daphne, in your opinion, was that one of the big mistakes that the government made, was to stop allowing the person's main caregiver to go to the CHSLD or to the home where they were in?
Personally, I think it was a very big mistake. I think it's very unhuman for a society like ours to absolutely not allow people to be with their families when they're very sick, and particularly if they have the virus, because how fearful they must be, and to allow people to die alone, older adults like that, in particular people with dementias, etc. It must have been so frightening and so terrifying for them.
Inhuman is a word that was used today at the news conference. Both the seniors minister, Marguerite Blais, said it, and so did the Premier François Legault, saying, you know, it doesn't make sense where you have an elder in a home and they can't see their own son or daughter for months.
Exactly. It does not make sense. It doesn't make sense at all. And I was very shocked when the government actually did this ruling. And I mean, we can see it just from sending out our petition that so many people have signed it and are pro the petition. So I expect that the government still has to agree to everybody being able to visit, and also that the CUSs, this is our social service and health centers, they have to allow the people to visit, because they were also giving much needed service, for example, feeding people who couldn't feed themselves, taking care of them all day long. They were people whom they knew, whom they loved, and we know from many studies that caregivers, family caregivers, are much more important to older adults than any kind of professionals or non-professionals who are taking care of them.
Yeah, and I want to further clarify that for caregivers who go to a home, if they are refused entry, there's to be reasons given as to why they are refused. So there has to be a reason there. Besides just the
that I thought was a good thing, by the
So
that I thought was a good thing, because before they were constantly being given, not given any reasons, and there was no communication. So now they have to give at least a reason if they are being refused, which is a good thing.
besides the humane aspect, which obviously is very critical, especially for someone who is not doing well and just wants to recover, there's the humane aspect of seeing a loved one come visit you. But when caregivers were refused, what did that do to the system and the structure of CHSLDs with which they operate? How much help and actual work then fell onto the patient attendants who were there?
Well, one of the big points is that we were short of staff in the first place. As you know, my organization wrote a report in 2019. It was finished and it was presented to the government, basically stating that there weren't enough staff, the staff weren't well enough paid, there were big problems, there wasn't a dedicated, stable staff in these long-term care homes for people. So that was already a problem before. Plus, they had all these very generous caregivers who were giving huge amounts of their time to taking care every day of their relatives. So that is a huge loss to the people themselves, but also to the establishment, because they had to take over the care. And now, I don't know if you heard it, but the Prime Minister was saying that they are short of 11,000 people.
11,200 people missing in the healthcare network. That's what the Premier François Legault announced today, and that prompted him to make another plea saying, please come out and help. And really what they're looking for is full-time workers. One of the problems with so much part-time work is that people rotate, so it's more people coming in and out of the system, which doesn't do much to control the spread of COVID-19. How much of a concern is that for you, Daphne?
That's a major concern, because the more people who get the viruses, the more people are going to die. In fact, it only takes one person to bring in the virus. And these are not even people that the people have relationships with. We know that relationships are the most important part of a person's life. They want a home that they're spending the end of their life in. And they don't, it's very scary to have all these strangers coming in, and the changeover of staff, and staff who are working in many different establishments, etc. They are low paid, so they have no pride in their jobs, many of them. Some of them are wonderful, but some of them really don't have pride in their jobs, and they have to work in several establishments in order to provide for their families, etc. So the situation is a mess and has been for a long time. It's not a new problem. This problem has been going on. In 2005, we were already complaining about the problems in the long-term care establishments and residences, etc.
What can the government do right now to help seniors and to help as a solution to fix this crisis?
Well, we asked for 4 things. If I just look at our petition, we asked for 4 things. The first thing was that caregivers be allowed to go in and back into their relatives and visit them as much as they wanted to, when they wanted to, etc. Obviously, they have to respect the rules. They have to wear protective clothing, etc. But they should be able to go in. There is no question about that. We also think that there should be an additional budget of $1.2 billion, just so that the ratios of staff to clients or residents should be much lower than it is because of the absence of staff, etc., and the limited staff. It should be reduced by bringing in new personnel, etc., training them, etc. So that is a major thing that we need. We also need home care services that could allow those people who are not in these long-term care homes stay in. 22% of them probably wouldn't have been there in the first place if there were additional home care services.
They could have opted for home care rather than be in residence?
Exactly, exactly. So these are some of the things that I think that they could do immediately. Those would be our priorities.
And Daphne, before I let you go, I'm curious to get your thoughts, because I was looking at some statistics last night, and when it comes to deaths in long-term care homes, Quebec is #1 in the world. About 8 out of 10 people in Canada who died, so 79 out of 100 deaths occurred in long-term care homes. In Quebec, it's even higher. It's in the 80s. And I was looking at other countries with the highest death rates, like Spain. Theirs is in the 60s. And France, it's in the 50s, I believe. So if we look at this, Quebec is the worst in the world when it comes to deaths of COVID-19 in long-term care homes. When we hold up a mirror and look at ourselves, what does this say about our society?
It says that our society doesn't care enough about older adults to really improve the conditions in there, to improve the conditions in terms of the staff, the salaries, etc. They're paying them the salaries of Walmart people. It just shows basically that society doesn't value old people like they do in other countries to some degree. And many of the countries have even changed their ways of doing things. For example, in, I believe, Sweden and Denmark, they have, Denmark particularly, I believe, abolished all of the institutions, and they just made very intensive care services in the homes, and a possibility to be able to make the homes livable in for people as they got ill and disabled, etc. So I think that those are much better options for our society and for our people than to put them in these almost warehouses, these huge institutions that are unmanageable and where the conditions are not humane.
Daphné, Nahmiash, we'll leave it there for today, but I want to thank you so much for your time. Really appreciate it.
Thank you.
Great to talk to you. That is Daphné Nahmiash. She's the acting president of Handicap-Vie-Dignité. It's an organization that advocates for improved conditions in long-term care homes, and she's also a retired professor of gerontology and social services at Université Laval. And as you heard, they submitted a report to the government. They've been sounding the alarm since 2005. And submitted a report to the government just last year on things that needed to change within the system. You can weigh in. Our text line 514-566-9066. It's 7 minutes.